Welcome here, everybody. We're really just so thankful to have this time for hearing from different people's perspectives at this conference. It's been such a rich time already. And this is really meant to also create space for conversation. So we actually going to sit pretty close to the time limit in order to facilitate questions after each session. So we're really delighted to have Zachary Daly, am I saying your name correct? Daly, sorry, I should probably know that, here to present on raising the voices of nurses in planetary health discussions. So Zachary is a registered nurse and has worked in child and adolescent mental health. He's currently completing his PhD in nursing at the University of British Columbia School of Nursing, where he's studying the impacts of climate change on mental health in Canada with a focus on youth. He is also a member of CANE, the Canadian Association for Nurses for the Environment, specifically the Public Awareness Team, which will be the focus of his talk.
Thank you for that lovely introduction. Yes, my name of my talk today is Raising the Voices of Nurses in Planetary Health Discussions. And you can see the members of the Public Awareness Team. I'll get to that in a second here in our lovely Zoom photo, because as I was just saying, some of these people I've worked with for years I've not met in person, but I guess that's the way of Zoom. Before I get started, I just want to acknowledge that I'm presenting on the traditional, ancestral, unceded territory of the Tsleil-Waututh people, and that I live and work on the traditional, ancestral, unceded territory of the Musqueam people, and the other members of the Public Awareness Team also live in other traditional, unceded territories across British Columbia. So I just have a quote. I do like quotes. There's a few quotes sprinkled in here. This is from the UN Secretary General, who said very recently, "Our world needs climate action on all fronts, everything, everywhere, all at once." So, a very timely pun. I believe that this includes nurses. I suspect that's not like a shocking statement for people in this room. Not too controversial, but why? Why do I think nurses are a good fit? So I think nurses are a really great fit for planetary health. We're a highly regarded and trusted profession. We're witness to patient community impacts. Rigorously trained, evidence-based, expert communicators, collaborators, and strategists. So we have training, that's something that we're very comfortable doing. Experience in advocating for vulnerable or marginalized populations. Promoting health and well-being, that's just like part of what we do, and I think everyone here would agree planetary health is relevant to nursing. We have expertise in climate change, environment, and planetary health, and I think that's growing, but there's a lot of nurses with a lot of expertise in this already. And we're already leading research, policy, and educational projects. But I think there's still a lot of work to be done. So I have some quotes. So this is from someone at Aggie who says, this is specifically really gross, Alaya, nurses are known to be the most trusted profession, which is hand to heart really great. But we need to move towards being the most influential profession. And I do think there is a bit of a mismatch there, that we're very trusted, but we're not necessarily always kind of putting ourselves to advocate or to use that voice to influence policy. And so there's this other really great quote. This is from a really neat paper by Gregory et al. And it's looking at social media activism of nurses. It's a really fun read. I suggest you check it out. And they stated, exploring new and creative ways for nurses to engage in activism is essential to maintaining the relevancy of the nursing profession, but also critical to improving the health and well-being of the individuals and communities for whom nurses care. And this sort of kind of sets up, I think, the context for what I'm talking about today, and the idea that nurses not just can, but should and must be engaging in activism around climate change. So who are we? Who am I a part of? A few different hats. I'm here wearing my CANE hat, the Canadian Association of Nurses for the Environment. For those who don't know who we are, we have a few goals. So we facilitate knowledge sharing. We support evidence-based planetary health practice. We hope to influence policy development and legislation to support planetary health. And we also promote educational and research opportunities. And if you are hearing about this for the first time, we actually do have a table out in the main lobby. Later I'll be standing there. Please come and chat if you have any just questions about CANE or want to learn more about us. More specifically, I'm a member of the Public Awareness Team of PAT, and so we have three main goals. So I'll kind of talk about how we've achieved those goals, or working to achieve those goals. Raise awareness of climate change and other planetary health issues among nurses and the public. Encourage evidence-based responses, and promote the voices of nurses on these topics. Which all sounds well and good. So how have we actually gone about achieving these goals? And this is sort of what I would like to talk about today and kind of focus on the practical and some lessons learned. So one of the things that I think is really neat, and this is actually before my time on the Public Awareness Team, but they developed a publicly accessible 2022 municipal election toolkit. And it's really cool. So they had ready-made graphics for social media posting that anyone could take and use. They also had a briefing note that was ready that people could use when they want to talk about this. They had questions for municipal candidates, like suggested questions to ask municipal candidates. They had an op-ed template so that nurses could take this template, modify it based upon their local context, and put their names, and then submit that to a local newspaper, as well as tips on just how do you publish an op-ed. Not everyone knows how to do that. And just sort of social media tips. And so it's this whole package that is publicly available. It's pretty amazing. And if we think about how things like this could be used potentially in practice, one example is, so there's an all candidates forum on the island 2022, October 2022, led by Kane as well as nurses at North Island nursing students. And this is for candidates to come and talk about planetary health, and quite a few of the local municipal candidates came. And then you see those ripple effects that have then coverage in local news and media, and so the reach kind of spreads out.
Yay, Courtney.
Exactly, yeah. We also, in terms of thinking about communicating directly towards nurses, because that's one of our goals, we have columns that we write for the NNPBC Nurse Practitioner newsletter. This is a new endeavor, so we just had a couple so far, and these are meant to be short, punchy, 250 words or less, which is a whole challenge in and of itself, as well as an upcoming article, it hasn't been published yet, but an upcoming article in Canadian Nurse that's a bit longer form, just looking at sort of, for the nurses that sort of think that climate change is important, but haven't quite seen the connection to nursing practice, so just sort of laying it out, like here's how climate change will be impacting your patients. We also work on communicating with the public, the general public, and so we've had op-eds and columns in local newspapers throughout the province, quite a few of those. So that's sort of things that we've done. What are some next steps? So we're going to continue writing articles for NNPBC and newspapers. I think this is a great way to reach both nurses in practice as well as the general public, which are two of our goals, as well as promoting sort of evidence-based responses for nurses. We're going to look into additional avenues to advocate through. So like what are other ways we can get our message out? Pursue additional articles with Canadian Nurse. I'm very excited about this. I know there's a wide readership, and I think there's kind of room for longer form pieces there. Also looking at updating the 2022 municipal election toolkit, because so much work went into it, and I think there's, elections happen regularly, and with some tweaking and updating, it would be ready to go again, and just making sure all that lovely work, because there's a lot of work that went to do that, could be used and then made publicly accessible again. So, to the practical, what are some lessons that we've learned that perhaps other people can take if they want to do similar work? One is that relationships matter quite a bit. So for instance, part of those, op-eds and newspaper articles, part of what helped facilitate that is relationships and people reaching out to and talking to local newspaper editors, building that relationship so that when an article is submitted, they kind of know who it's coming from rather than just sort of out of nowhere. So relationships really do matter in this work, as they matter, I think, in all nursing work. Once again, a really shocking statement on my part. I will say, be prepared for some pushback, and I think this pushback can come in different forms. So some of it, I think, is very well-intentioned. So sometimes I'm talking to nurses, and they're like, yeah, climate change is important. I think it's important, but they don't necessarily always see the connection. But I think you can talk to people and explain, well, actually, here's why it's related to health, and people kind of get it, and it's sort of well-intentioned. But at the same time, I think you need to learn when to engage and when to step back. So sometimes you'll get feedback or responses that I think are not in good faith, and just learning, when to engage with that and when it's just best to let the person's comment stand for it is, and people can see. So sometimes, unfortunately, there's still people that think nurses should sort of butt out about this and just sort of stay in the hospital. I don't think that's a common sentiment, but it's still, some folks kind of have that view. They just don't think of this as something that nurses should do, which is unfortunate. I think you need to tailor your message to the audience, and so related to that is short and punchy can be better than long and in-depth. And I think of this as what myself as a PhD student, I'm very enculturated into the sort of the academia, a million references, super long way of communicating, which is one form of communication and can work in some settings, but is not going to work great, say, for social media. And so learning, even for myself, is to take a lot of learning, how do I do this in a shorter way? So those NNPBC newsletters are 250 words. How do you distill something down? Or a social media post, even shorter. So learning when to do that is really important. Take on initiatives you are passionate about, especially if this is ongoing things. Like, find something you want to do and do it. If you're finding like, I really don't like doing this, you're probably not going to do it over the long run. And related to that is the importance and benefits of working as a team. So as I said, I'm part of one member of the public awareness team, and it really is a team effort, and there's a joy to this work as well as just, one of us can write an article, and rather than just submitting off, they can send it to the group and say, hey, does anyone have any feedback? And there's always really interesting and valuable feedback to improve the quality. So I think working as a team is important in terms of just the benefits of what you're doing, but also just it's more fun this way. Like, I look forward to the meetings, they're enjoyable. And I think that in this work, because it can be heavy and long-term, it is important to find ways to bring joy into it. And also just say, don't underestimate your reach. So I think, you publish this article and you think people read about it, talk about it. We hear about people that reach out to us, say, oh, I read your article, it's really interesting. And so I think the reach can be farther than you think. And especially as nurses, I think a lot of people are curious to hear nurses' voices on this, as well as other folks. I think a lot of what I talk about here could be sort of taken by other folks that are not necessarily nurses. And so just in conclusion, while not situated at the bedside as it's traditionally envisioned, we believe that planetary health advocacy fits within a widened sense of what constitutes nursing practice. This is what I think about. So on PAT, Public Awareness Team, so we love acronyms in nursing, we're not nurses doing advocacy, we're nurses doing nursing. And that this is nursing work that we're doing. Thank you. Then there's a QR code for Kane.
Thanks very much. I'm learning about planetary health at this conference alone. I'm a physics professor.
Yeah.
And I'm just wondering, like, during the pandemic, there was a small but vocal group of nurses who spoke out, against vaccinations, for example, and there's even some going, taking government to the court and so forth.
Yeah.
How does that? Is there something similar in this issue? Like, is there a small vocal group of nurses who are also sort of objecting to the reality of climate change or anything like that? Or is it much more clear to nurses in general that this is actually happening and it's having an impact on them?
Yeah, I can speak to my own personal experiences. What I will say is that nurses are a very broad group of people. Like, there's a lot of nurses in Canada and elsewhere, and so because of that, there's probably a lot of different views. My most common experience in interacting with other nurses, either that, like, yeah, I get it. Sometimes there's a slight, particularly my research on climate change and youth mental health, well, I'll have folks sort of initially being like, oh, that sounds good, like, how is that mental health? But then it's very easily, I just explain, and then my experiences are like, oh, yeah, like, of course. So my personal experiences have been pretty positive. Now, obviously I'm not attempting to speak for all nurses everywhere, but that's been sort of my experience. Even when there is pushback, it's sort of in good faith, and you have a conversation, and people kind of get it. Question.
Just a quick question, but maybe not an easy question. One of the things that I observed is that nurses struggle to use and then translate evidence. And in fact, we very quickly forget that we actually need to be able to do this and articulate this. What resources can this organization draw on? Or how do we build capacity to be able to speak the way that Jessica spoke, for example, today? We can have access to that data, but it seems like nurses really translate with that and are difficult translating. And then I'm curious how you use KT models, and do you have KT people helping?
Yeah, so I think it's a great question, and I think that's one of our goals is to encourage evidence-based practice. I think that's absolutely critical. So there are a lot of resources out there. I think one of the issues is there's always the balance between like creating new resources versus recognizing that there's a lot of these already out there. And so there's one in particular, the Planetary Health Toolkit that Kane co-developed with CFNU, thank you. That is like a really wonderful evidence-based resource that has been developed. But yes, I agree, there's always room for ensuring we're doing evidence-based and best practices.
Yeah, so this being 72.
Thank you so much, Zach. That was amazing.
I can follow up with you privately.
And I think, Zach, just so all the resources you talked about are available on this website, right?
So there's quite a few resources.
Yeah.
So this is I think my understanding is QR code.
Okay.
Twitter, YouTube, all that sort of.
Because I think a lot of us were like, "Whoa, we could use that here or there." So fantastic.
Well, we also have infographics at the front. We have
come chat with me outside.
Awesome.
yeah,
Thank
we have
you.
a booth table.
I was just so informative, and you packed a lot into 10 minutes. That was super impressive.
Our coffee.
Yeah.